Every day at lunchtime, KECHARA Soup Kitchen in downtown Kuala Lumpur hands out food packs to those in need. The nationwide lockdown has shut all non-essential businesses until the end of the month, creating hardship for some.
There's a sharp rise in terms of people in their 40s or 50s coming in for food, and most of them actually have a job beforehand, and it is because of this pandemic itself, their business of their employers closes down.
Now the government has extended a 2-week lockdown for a further fortnight, citing the high number of new COVID-19 infections. Healthcare facilities here are overstretched. Private hospitals have been asked to increase the number of beds for COVID-19 patients, and the armed forces will build 6 more field hospitals in addition to the 3 set up earlier. Malaysia's COVID-19 positivity rate of around 7% is higher than the WHO's threshold of 5%. Furthermore, more than 80% of reported infections don't belong to an identified cluster, indicating the infections are sporadic or unlinked. Public health policy specialists say this data indicates a lockdown will not be enough to reverse the trend of rising infections.
Look for the cases instead of expecting the cases to come to you. Find, test, trace, isolate, and support. When you do more testing, though, it will mean that the positive figures will go much higher than what we see today, but it will also mean that more people can be treated earlier and save lives.
The government has accelerated its vaccination program, including rolling out mobile units in areas where residents may have difficulty getting to vaccination centres. Just 4% of the population has been fully inoculated so far. The government aims to reach herd immunity by December, but the slow delivery of vaccine supplies and delays by manufacturers may hinder this goal. Florence, Looi, Jazeera, Kuala Lumpur.